By now, you've seen the staggering numbers from the COVID outbreak. Nearly 85,000 Americans dead and 1.4 million people have tested positive. But there's also a huge number that most people aren't talking or even thinking about. Survivors who now have a long road to recovery. For them, rehab is an important and critical next step. That's where my next guests come in. Dr. Matthew Bartels from Burke Rehabilitation Hospital, which is part of the Montefiore Health System. He joins us now. Doctor, I appreciate the time. How are you?
Very good. Thank you.
You know, as we say, and basically you look at any television screen and we're as guilty of it as anyone, we put up the two numbers or four numbers if it's global and then domestic as to how many people have tested positive and the fatality number. And unfortunately, you know, we follow, daily as those numbers have an uptick. But then there's the people, we see the images of them coming out of the hospital, sometimes on wheelchairs, even sometimes after being on a vent and coming off, or people that may have gone through this and either they gritted it out at home or whatever the case may be. But we're learning that COVID still takes a toll long after the virus has passed. Talk about some of the things that have lingered in patients, both in modest and really acute forms.
Yeah, that is one of the tragedies of this very, very severe pandemic, is that we're seeing so many individuals who are having a lot of disabling illness after they complete their course of treatment for their acute hospitalization. So the patients are coming in with pulmonary problems. As we're all aware, there's a lot of pneumonia, there's a lot of hypoxia in this population. Another thing that we're seeing is a large number of patients that are coming in with severe muscle dysfunction, a lot of patients that have mild cases that are never even hospitalized or complaining of severe muscle myalgias and have a lot of weakness afterwards. And then another thing that we see is a great number of patients who are coming in with a lot of fatigue. So you start doing your normal return to activity and very quickly you get so tired that you can't continue the activity. So for example, walking down the street to go to a local store or trying to resume work and go back to work is going to be an overwhelming, fatiguing activity. Another area that we're seeing a very surprising number of patients are coming out with events that are related to hypercoagulability or the fact that the blood is clotting. And that is one of the things that the COVID virus causes. And we are seeing patients come in with strokes and also patients who unfortunately are having amputations because they're actually losing limbs.
As I said before, there's really two categories, fatalities and those positive. But how prepared are both people who survived COVID and their families for the long road ahead? Because it's really not discussed as much just how much that this is something that stays with so many people. I think people believe that you fall into those three categories, the positive, the fatalities, and then those who, hey, it wasn't that bad and I'm back to work. And there are a lot of those, but I'm just not sure people get their arms around just how long and difficult the rehab process can be.
That is actually a big concern, and most people are not prepared for any disabling illness. I mean, it's not one of the things that a person plans for. But now with COVID, we're seeing so many people at once with such a variety of things that, they are very happy to have successfully come out of the acute care hospital, but still have the issues. Nobody's totally prepared, but as a health system and as a healthcare institution, we are prepared to actually help people get over their disabilities. I mean, this is something that Burke has been doing for well over 100 years. And this is not the first pandemic to speak of that has been seen or treated by rehabilitation physicians. Because if you go back, initially Burke and a lot of rehab institutions were to treat the, so to speak, pandemic of disabled veterans from World War I and World War II. But then with all of the polio epidemics in the 1950s, there were many rehab hospitals that really focused on restoring those individuals back to function as well. And then we had in the 1980s and 90s a whole burst of people who had AIDS, and we were treating them and having them get restored. So it's not something that we knew was coming, but it's something that we are prepared to help people with disabilities get back to their higher level of function.
You really took me where I was going to go next. This is not the first rodeo for Burke. In fact, you guys came into being really at the end of the Spanish flu, this is probably the closest pandemic this resembles about 100 years ago. You've dealt, as you just articulated, with other challenges, but Does anything approximate to what we're dealing with now? We've had pandemics, but they've largely been in Asia or in Africa, at least of the scope of this. This is something different.
Yeah, and for our experience, this is a very different experience because we've never seen this volume of patients from a brand new condition this rapidly. We went from 2.5 months ago, having never seen a patient who survived this disease, to having had well over 300 discharges of patients that we've rehabilitated just from the hospital. And that doesn't count all of the outpatient encounters that we're doing. But the other challenge here is, unlike a lot of our other surges of patients that we've seen, the social distancing and a lot of the other limitations that are placed on trying to prevent transmission have made that more difficult too. We are still providing outpatient services, but it has to be at a lower volume and speed because we don't want to expose staff or patients unnecessarily to risk. And so we are now adapting and coming up with new ways to be able to take care of patients. So it's an adaptation not only in the types of patients, but how we are actually treating the patients. It is unprecedented.
Hey, doctor, I appreciate all the time, and also I wish the best of luck going forward. Thank you.
Oh, thank you so much.
Up next, we pivot to politics. Candidates everywhere, they're off the campaign trail, obviously due to COVID, but they're still bombing the airwaves with ads. After the break, we're going to show you some of the most effective commercials. Stay with us.